So I first would like to thank you for the invitation for this conference. And I have been working in medicine for 35 years now. I have been working in smaller and bigger hospitals, in private practice and in public practice. But at the end of my career, I'm a little bit saddened to see the evolution of our healthcare system. So the last few years, I have decided to reorient somewhat my career. And I became a professional coach in healthcare organizations. So in this way, I would like to share some more philosophical considerations with you. Here you have a picture of my mother. She's 88 years old, and she lives alone for 35 years. But since the beginning of COVID, she suffers a lot of loneliness. So a few months ago, during a routine gynecological examination, a prevertebral abdominal mass of 10 centimeters was found. A workup revealed a chronic lymphoid leukemia. She received a targeted oral therapy, which was believed to give her an improving of the situation with few side effects. But this was not really the case. She had frequently diarrheas, she had a lot of abdominal pain with cramps, and she began to lose weight. So she was told that this could be normal at the beginning, it should improve later, but it didn't. So when I went to see her, I saw that she had lost 10 kilos, and she was no more very clear in her head. So I asked for an early appointment to check the situation, and she got hospitalized. But the hospital stay was really a nightmare, not only for her, but also for us. So there was no communication between her and the medical staff, who changed twice the few days she was there. There was also no communication with the family. So my daughter, she is a veterinary medicine, and she tells me that when they have a cat who is hospitalized, they call the family every day. In medicine, it's not like that. Also, my mother, she had sympathized with her roommate, and she was happy to be not anymore alone. But then, after 3 days, she got changed. She went to another room, and she lost her roommate, and she was with another lady who was completely dement. Also in the room, there was a phone and a television, both on the same control channel. But she didn't go along with technology. So she was not able to call us, and we were not able to call her. Finally, the doctor, he was very happy. He told her, the mass has decreased by 30%, so she can go home. Everything is perfect. But we were telling, yes, but what about the rest? About her anxiety, about her abdominal cramps, and so on. So it was decided just to lower the treatment. So she finally went home, but then they called my brother 2 days later to tell her that there was a problem with the treatment they had given her, because they had given the wrong treatment, not the lower dose, but the first dose. So unfortunately, this is nowadays the standard care in our hospitals. The doctor makes a diagnosis, he prescribes some drugs, and he charges. But who takes care of the patient as a human being, and who takes care of his general well-being? I guess even if you are young, you have yet been in the position of a patient. So how do you feel when you begin a story to talk to your doctor and you get interrupted after 10 seconds? So what do you think when you see the doctor disappearing behind a very huge computer screen? He's barely looking at you whilst he's typing the whole time. And are you really confident when, after a very limited clinical exam, you get some technical explanations that you barely understand, and when you get a medical prescription without any explanation? So as a healthcare professional or future healthcare professional, have you asked yourself the following question: what is the patient looking for when he's choosing a doctor? Does he only look for somebody who has very good technical skills, Or will he be pleased to have a doctor who is friendly, listening, communicating, and having empathy? So I know that nobody is talking about that during medical studies, because everything goes about technicity and problem solving. So when you see these pictures you have on the left side, the situation at the end of the 19th century, when you see the doctor depicted by Luke Fiedler, and you see that the Tate Britain in London. So that's the way the doctor looked after the patient before, and on the right side you have the situation how we look to the patient today. So the real patient in the bed became an e-patient on the computer. Of course, medicine has a lot improved with technology. We are now able to make deaf people hear. We are able to make some blind people see. And we are even able to make amputees walk and run and win Paralympic Games. So robots and artificial intelligence are of great help, but will gradually replace some parts of our medical work. But they probably will not be able to replace, for me, the most important part of caregiving, which is humanity. Do we really want to lose this? So 10 years ago, when I was beginning to run my department, I had a lot of problems. There were a lot of arguing in the department, the atmosphere was not very good, and I was thinking of firing some people. I was judging myself, people in being good, in being bad, like the assistants, until the moment I was really aware that the problem were not the people themselves, but I was unable to have the necessary management skills. So that's why I was beginning these coaching lessons, and I became aware of the importance of having a good communication. So he taught me it's not only necessary for somebody who is running a department, but it's also essential if you want to be a good doctor. Because communication is crucial in any situation. Our communication will influence the whole medical support, because it can have a placebo effect, you know that all, improving the healing process, but it can also have a nocebo effect and worsening the situation for the patient. So a patient has his beliefs, which are influenced by his education and his experiences. He has his emotions, his anxieties, and his difficulties. But the doctor also, he has his beliefs, his emotions, and also his personal questions. So all this will influence a mutual communication. So as you see here, there is a long way from what you think and what you want to say and what you really say. What then the other person will hear, what she is listening to, what she understands, what she accepts, and what she finally will integrate. So there are so many filters, and there are so many possibilities of misunderstanding. Also, you have to be aware of the importance of non-verbal communication. What we say are only 7% of our communication. The body language consider 55% of what we are saying, and the intonation and the sound of our voice go for 38%. So you always have to have that in mind when you talk with somebody. It's not only the way, it's not only what you say, but also how you say it that will influence the patient's trust. Also, when you meet your patient, don't forget to introduce yourself, to give your name, to have a smile, to be some natural. You must not show that you are the doctor and the patient is the patient. You can have some humor, and the patient will appreciate this relationship. So a good relationship in medicine, like in other situations, begins with active listening. So active listening means not to interrupt the other person when she's speaking. Also to look at the patient and not at the computer. to try to understand not only what the patient says, but also the stress and fears that are behind. You ask questions to have a better understanding of the situation, but not only on the medical things. Ask what the patient is working, what are his interests. And this will give you a lot of information. We will help you later to make a better diagnosis and also a better treatment. So considering this active listening and the relationship to the patient, I have a vestibular physiotherapist who is a colleague at the hospital. He is treating patients for vertigo, which is a very stressful situation because the environment is moving all the time. But he is, for me, just the best physiotherapist ever. He has so good communication skills that immediately the patient has trust and confidence, and he will do the exercises that are needed. So, for example, when I was a postgraduate in France for 1 year, we had a lot of patients with Meniere disease, so dizziness. And these patients, they got on a large basis operated by a vestibular neurectomy, which is not only a complicated operation, but which gives a lot of uncomfort after the operation. So every week, patients got vestibular neurectomy. Then when I came back, I was sending my Meniere's patients to this physiotherapist. And there was no more indication for vestibular neurectomy. I had myself a vestibular neuritis a few years ago, and I went to this physiotherapist, and I was really astonished how he was able to manage, how he was able to listen and to communicate. So there are a lot of stress-induced pathologies, not only Meniere's disease, but you have also tinnitus patients, you have chronic back pain, and so on. So for my tinnitus patients at the hospital, I always take a lot of time to understand why the patient got this tinnitus. Was it triggered by a personal or by a personal stress? What are the beliefs behind this pathology? Because they are not always the same. For example, in India, when a patient has tinnitus, it's like he's blessed by the gods because they are speaking to him. These are not the same beliefs for us. We know that this pathology is related to outer and inner hair cell loss. So these inner hair cells will not come back. So there is no possibility to regenerate them. And if we just will give a medical treatment, it will not improve the situation. The emotional brain considers that there is something missing, and the emotional brain will try to compensate the missing frequencies. And that's why we have the tinnitus. It's like when you have a phantomatic pain after an amputation. So if you don't have a clear medical treatment, don't give it to the patient. Give explanations, tell him why the pathology is there and what he can do by himself to improve the situation. He can have another view of the problem, he can have another mindset, he can do things to be relaxed and improve the situation. So he is his best doctor himself. I agree, it's not always very funny to listen to the patient. We prefer to act and to talk, but it's very important. This is also a very important message. A patient is not a pathology. He's not just a hip prosthesis at bed 9, but the patient is a person who has to deal with the pathology. He does not consult a doctor to get some medicine, but he is looking for some relief and a solution to feel better. So after listening, the second step, that's also important, is physical examination. This exam should be as complete as possible. It's not only the fact to examine, but you will touch the patient, and this will create a better contact with him. You can also use different tools like endoscopes. You can, for example, fix an endoscope on a camera, and then I often use cameras to show the patient his tympanic membrane perforation or polyp on the vocal cord. So the patient, he understands better what is there, and he will also understand better which treatment you give and why you will give this treatment or why you will suggest it. In some cases, we need complementary exams. So go only for the exams that are necessary. It's not only interesting for social security, but it's also good for the patient. You will respect him. You will not do 10,000 exams. It will take him time, and every exam can also have side effects. When you come to the diagnosis, there we come to the communication again. Be aware of the power you have in announcing a diagnosis. And don't forget the importance of your nonverbal communication, especially if the news are bad, like for life-threatening situations. The patient, unconsciously, he will consider your nonverbal communication. Also take a vocabulary that is comprehensive to the patient. Speak first to the patient and then only to the family. Let the patient feel that he is important. This will lower his stress, build up trust and confidence, which is the first part of the healing process. There's not only one way to treat. Every person is different, so also every treatment should be different. Don't give too much medication, because I see it often when I go to the pharmacy. The patient, he is choosing what he will buy and what he will leave. So if you give 5 medical treatments, he will not take them all. One important thing is this. For everybody, thoughts are related to beliefs, to opinions, and to mental images. That's our head. Our head will influence our emotions and the physical sensations. And this will lead to a specific behavior for you and for the patients. There is a constant interaction between body and mind. So if your mindset gets better, the emotions are better, and the body will get better. So it's important to tell the patient that he also is so important in his own treatment, and that the patient should be an actor of his own life. Also explain how the medication should be taken. I see that all the time when I have patients with a running ear. People make prescriptions, they give antibiotics, they give droplets, but nobody explains to the patient how he should do this. So for example, for a running ear, if you put some water in the ear, you can give all the medications you want. It will not work. You have to take time to explain to the patient how he should wash the hairs, what he should do, how he should put the droplets, and then with a very simple treatment, you will have good results. To have a good communication, humans, we have 2 special powers, which are empathy and creativity. Unfortunately, these 2 qualities are often missing in our actual healthcare systems. So politics and hospital managers want to run hospitals like any other business. The CEOs are recruited in business schools. They are rather considering economics more than human values. The computer controls everything, and you know it. Caregivers complain about lack of qualified staff, too much medical and administrative paperwork, a lack of equipment and resources, and a general lack of humanity and emotion in favor of standardized protocols. That's the only word for the moment, standardized protocols. This leads, unhappily, to lack of motivation, to decline of creativity. We need creativity in medical science, and often ends up with burnout. And of course, burnout will lead to a lack of empathy for the patient. Unfortunately, burnout has become ubiquitous in our care facilities. In 2016, a survey conducted by Status International among 1,905 healthcare professionals in France showed that nearly half of the professionals believed they were in a burnout situation, and 40% were concerned by addictive behavior like alcohol consumption, psychotropic drugs, and others. In 2021, it's even worse, because after COVID, the situation got worse, and 7 out of 10 healthcare workers are currently experiencing a burnout situation. This leads to errors in diagnosis and medical acts, and also to emotional and psychological detachment of practitioners towards patients, which degrades the quality of care. So I think especially you, as young students and young doctors, you must fight first for a better education in communication, for more humanity in our structures, for more independence and creativity. Medicine is not just business. We do not need only to have technical skills, but we need skills in personal development, in communication. We also need to open our minds towards alternative therapies in order to give the best possible advice and treatment to our patients. For me, I think we should finally go to mindfulness care. So mindfulness, I hope you have yet heard about that. It's a state of mind that allows you to pay attention to the present moment on purpose and without any judgment. So mindfulness got introduced in the 17th by an American doctor, John Kabat-Zinn. He was professor at the University of Massachusetts Medical School and founder of the mindfulness-based stress reduction. He was the first to use it in cancer and pain departments in American hospitals. In Europe, it got promoted by the French doctor David Servan-Schreiber. So mindfulness will help to reduce stress and anxiety in you and the person you are caring for. With less stress, you will manage situations and interactions more thoughtfully. You will be able to have more empathy, compassion, and sensibility. Also, mindfulness increases concentration. You stop multitasking and you focus your attention on one thing at a time. So it reduces the likelihood of making mistakes. It will improve the quality of the care, will be more secure and focused on the patient's needs. Last but not least, mindfulness supports better self-care. You will be aware easier of your limits. You will stop and look after yourself. So it will reduce burnout. For the last 18 months, COVID-19 has worsened the situation in our hospitals. The different staff members have had to continuously adapt to unknown and very stressful situations. The instructions were not clear, many people were dying, and even at the present, nobody knows when this situation will finish. Being separate from our loved ones for weeks and months has been a difficult ordeal. We became much more aware of the importance of human contact, of good relationship, and we have seen how much distance makes human beings suffer. So should we not take advantage of this time to challenge ourselves, to analyze our roles as doctors, and consider not only the organ-specific pathology, but treat our patients as a whole person with his body, his mind, and his spirit. Thank you.